It's hard to believe it's almost time to head back to school, but back to school start dates are right around the corner. Today, UofL Health's Dr. Jennifer Daly has an important reminder about the #1 priority for those back to school lists. That is, of course, physicals. So let's start with the appointment. What are you looking for during these back to school physicals?
We often are looking for things that may not have symptoms per se. So when someone is coming in and kids, if their blood pressure is elevated, they may not have any symptoms of that. And so part of the physical exam is, or the physical itself is getting vital signs, looking at their growth, looking at their vision, and then doing an exam, but also reviewing their medical history as well, making sure they're meeting kind of all of those milestones of growth and development. So it's an opportunity for parents to get their kids in front of their physician to kind of review everything. Are they sleeping okay? Eating okay, what their diet is like. So we think about it as being kind of a sports specific thing, but all kids should be getting in annually for a wellness visit. This is just sometimes the way that we get them in the door.
And it can be a really important visit. What are some of the things that are specifically you might find here that make these yearly check-ins so crucial?
Yeah, so I think the big things that we worry about or is always on our mind are cardiac issues. So identifying a heart murmur that maybe was never there before and now you are hearing it and able to take the next appropriate steps. Vision is another big one that can kind of creep up and can impact safety in sport if you don't have corrected vision in some circumstances. And so the vision component and the cardiac component, blood pressure, those are, would say, the three big things.
And who can give a physical? Where should parents be turning to make sure they're getting the right appointment with the right person?
Yeah, I think that often we rely on our primary care providers. So that might be pediatrics, family medicine, nurse practitioner in those clinics. So anyone trained in adolescent and youth medicine. But you can also get those at urgent care facilities as well, and in sports medicine clinics as well. So primary care is kind of where we start, just because those providers have your growth charts. They can really look and make sure that our kids are meeting their milestones, but you can get them at lots of locations.
Well, thank you so much. A really important reminder, and especially when you hear the part about cardiac issues, not something that you want to delay on getting noticed.
No, exactly. Thank you.
Thank you so much for coming on today.
My pleasure. Thank you.